I am here to present the Dory Storms Award as our first award today. Since 2001, Core Group has presented the annual Dory Storms Child Survival Recognition Award to a person or persons who demonstrates courage, leadership, and commitment to helping NGOs have an impact on and effectively implement programs that end child death. I'm proud to announce the 2021 Dory Storms Award winner is Bonnie Kittle. And Bonnie was nominated by Mary DeCoster, Tom Davis, and Alan Tallons. Let me tell you a bit about Bonnie. Bonnie has made social behavior change and barrier analysis her life's work and passion, and that work has effectively contributed to the reduction of global maternal child morbidity and mortality. Her contribution and influence as an SBC thought leader and master trainer has made SBC using barrier analysis one of the most successful strategies used by NGOs around the world to improve child survival and development. Bonnie has worked in international development and public health since 1974, and she's had multiple assignments around the world: Africa, Asia, Latin America, and Caribbean. Her work includes child survival project evaluations and capacity building of staff from 40 plus core group member organizations. Bonnie's contributions are many, including co-chairing the core group social behavior change working group for 3 years, designing for behavior change or DBC curricula, and facilitating advanced workshops on DBC and barrier analysis. She co-authored Make Me a Change Agent, which is being used by Peace Corps volunteers around the world and is available on the website of Core Group's website. She's also published 30 plus barrier analysis questionnaires on multiple topics. Her most notable published work is probably the Practical Guide to Conducting Barrier Analysis, which is very useful for practitioners in designing evidence-based behavior change strategy. So make sure you check that out also on the Core Group website. Through Bonnie's work, Core Group members and development workers now see social behavior change in a different light and are more cognizant of the importance of formative research to inform behavior change. She's inspired many NGOs and individuals, and even in her retirement, she continues to enjoy providing technical assistance. I'm personally very grateful for Bonnie's technical leadership and dedication to collaboration over the many years she's been with Core Group. Bonnie, I congratulate you. You've been a real inspiration and leader. And now over to Bonnie for her acceptance speech.
Good morning, everyone. I'm so very honored to be here with you today to accept the Dory Storms Award for my work in community health. When I learned that I'd been nominated, I felt that I had already won. I was so very touched. And actually, throughout my career, I have felt blessed and honored to have worked with many of you and been a member of CORE. I'm sorry that we can't be physically together this year, since coming together at the annual CORE meeting was something I look forward to each year. For me, it meant I would not only learn new things and share what I had learned, but I would see my friends and make new ones. Many of you are like family to me. We have not only worked and traveled together, but we have celebrated marriages, the arrival of children, and even grandchildren. And we have together, sadly, mourned the passing of fellow core group members. It is these long-lasting ties between core members that make this a special group. We're not just a group of individuals seeking to gain new knowledge and skills. We are people who commit to sharing our skills and experiences, our innovations and trials to save lives, to make the world a better place for everyone. I've been a member of CORE nearly since its inception back in the late 90s, back when we were all learning how best to implement child survival projects, how to conduct KPC surveys, and to develop and use innovative approaches to save lives. Back in those days, the ORS packets were a novelty. The Sternans had just developed the PD Hearth method, and we were focused on increasing vaccination coverage. Over the years, members of the core group have joined together to help each other learn how to fight deadly diseases and to branch out into complementary fields like water and sanitation, food security, disaster relief, gender equity, and many more. Our participation in CORE makes our work much more effective and fun because it provides a platform for us to share our skills and share what we have learned. And this, my friends, is my takeaway after 47 years working in community health. It's all about collaboration and sharing. So let me take this moment to congratulate you for being among the collaborators, among those who eagerly share your skills and what you have learned. And let us together look to the future of more learning and sharing. Thanks.
Greetings. I'm Sarah Ford from Catholic Relief Services, and I'm with you as the chair of Core Group's Board of Directors to present our first ever Community Health Champions Award. This important and prestigious award is given to an individual who has had a direct and sustained impact on the health and well-being of their community through their vision, their passion, and their leadership, ensuring a better future for all. This first ever award is given to Ms. Doreen Namagatsi Ali from Malawi. Ms. Sarah Fisher nominated Ms. Doreen Namagatsi Ali, and I'll read you her nomination now. I'm honored to nominate Doreen Namagatsi Ali for the first ever Core Group Community Health Champion Award. Doreen embodies the very definition of a community health champion. As the head of the Community Health Services System within the Ministry of Health in Malawi, Doreen fights for accessible, high-quality, and equitable care for all across Malawi's 28 districts. The Community Health Services section is a young section, but in only a few short years, Doreen has ensured that it is a formidable program at both the national and the district levels. Doreen built a comprehensive national healthcare strategy through collaborative engagement with districts, communities, and frontline health workers. The first of its kind in the country, the strategy details the scope, responsibilities, and plan for overcoming the challenges to sustainable community health care and for ensuring universal health coverage across all of Malawi. Doreen is a true champion. Despite working at the very highest levels of government, she has never lost touch with the realities of communities in Malawi. She is passionate about community health workers and works to ensure that they are trained, equipped, and managed effectively. Doreen fights to ensure the success of the community health system and is dedicated to its cause. She is a strong leader and one who is sure to leave a lasting impact on the Malawian health system. I have no doubt that leaders worldwide will look to Doreen for guidance and support as they develop their own community healthcare systems. On behalf of Core Group, I congratulate Ms. Doreen Namagatsi Ali for winning the Community Health Champions Award. Congratulations.
I'm deeply honored and grateful to be honored with the first Core Group Community Health Champion Award. I'm very thankful to Sarah Fisher for nominating me for this award. This award is testimony to the significance of community health in Malawi and beyond. It is therefore with great honor and humility that I accept this distinguished Core Group Community Health Champion Award. What is my motivation? I'm motivated seeing positive impact of the National Community Health Strategy rolling out in communities. My family is also my greater motivation. They see me as a strong woman and a role model. My Secretary for Health, Dr. Charles Masamba, who is head of the Ministry of Health of Malawi, and Dr. Stone Kabuluzi, Director of Preventive Health Services, who entrusted and supported me when we studied the community health service section. Development and implementing partners that are supportive and always believe in me. My vision of community health in Malawi is to ensure that livelihoods of Malawians is improved. Healthcare reaches every household. To have communities participating in their own health, and also to have an integrated community health system which is built by all players, including communities themselves, and medicine change to think more of prevention. Lastly, I sincerely thank Core Group for providing me with a 1-year free membership to the Core Group committee. This will give me an opportunity to share the lessons learned and best practices, including experiences of community health implementation from the warm heart of Africa, which is Malawi. Thank you all, and may God bless you. Thank you.
Good afternoon. I'm excited to present the second annual Working Group Co-Chair Appreciation Award for 2021, presented to a co-chair who has demonstrated leadership and technical expertise in guiding and motivating the activities of the working group. This award recognizes the co-chair's commitment to core group's mission and contributions to advance the technical focus, innovative thinking, and new ideas of the working group and interest group. In 2002, I had the opportunity to serve as the first co-chair of the TB working group. I believe working group is the soul of core group, where people, ideas, and institutions come together. Despite the challenges of last year, this year's winner stayed committed and led with enthusiasm, ensuring everyone's ideas and voices are heard, especially young people from across the world. This year's winner is Dr. Arti Patel Varanasi, co-chair of the NCD Interest Group. Dr. Varanasi is the president and CEO of Advancing Synergy, a company advancing technology solutions for health, particularly virtual, personalized support to women undergoing breast cancer treatment. Formerly, Dr. Varanasi was a senior study director at Westat and managed a variety of research and informatics projects, including analysis of several nationally recognized epidemiological studies. Dr. Varanasi was also a cancer prevention fellow at the National Cancer Institute, where her research interests focus on immunity, nutrition, and cancer prevention. Dr. Varanasi holds a PhD in pathology from the University of North Carolina, Chapel Hill, and a master's in public health from the Johns Hopkins Bloomberg School of Public Health. Dr. Varanasi currently teaches molecular biology, epidemiology, and psychological determinants of health at AAP. Congratulations, Dr. Varanasi, and I wish you the very best. The award winner will be up on the core group website after the conference. Have a wonderful day.
Greetings, I am Dr. Arti Patel Varanasi, President and CEO of Advancing Synergy, where our work focuses on achieving health justice and equity for all. We do this by developing innovations that empower individuals and impact communities. I am truly honored and humbled to be a recipient of the Working Group Co-Chair Award this year. I was truly surprised and overcome with emotion when I received the email from Lisa. Working with Lisa Hilmi as the Executive Director of the Core Group team and the extended community has been a wonderful pleasure and privilege. I thank my dear friend and colleague, Dr. Michelle Farmer, for introducing me to Lisa and the Core Group. I'm deeply grateful for the opportunity to serve Core Group, and in all honesty, it has been one of the constants that has helped me navigate the pandemic this past year, and I'm sure into 2021. I have appreciated the opportunities to learn and engage from a diverse and committed community of implementers who get things done. Central to Core Group's mission is convening global health practitioners to share knowledge, evidence, and best practices, with the result of having a direct impact in the communities they serve and beyond. Our work with the NCD Interest Group has drawn from this mission and focused on convening those working to treat and prevent NCDs at the community level and to share resources within core group and the other working groups and across the global community, events and vital information to improve their work locally and globally. NCDs are responsible for more than 41 million deaths per year, and 85% of those occur in low and middle income countries. Our goal in establishing the NCD Interest Group webinar series last year, entitled Integration of Non-Communicable Diseases into Global Health Programs, a roadmap to achieving the Sustainable Development Goals in 2030, was to do more. We aimed to identify sustainable opportunities and solutions for integration of NCD priorities into global health programs. The credit for making each of these webinars a success has been our wonderful and engaged steering committee. Our monthly meetings are always a source of inspiration and action and lively dialogue. I invite you to join us as we continue on the theme of creating a roadmap to achieving the SDGs in 2030 with the focus on the interplay between NCDs and COVID. And as we move forward as a global community, a community that is rooted in equity, justice, humility, accountability, and action. Again, I thank the core group for this honor and award. I wish you all peace and love. Please stay safe and be well.